powerful new thinking on pain relief. Hey everyone, this is Dr. Jeff Williams with Creekstone right here in beautiful Amarillo, Texas. And I'm coming to you again this week with another video. It's just a quick refresher on pain and current ways to treat it. So let's get started by pointing out that there are really two main different types of pain when we're talking about how long the pain has been nagging. The first one is called acute or subacute pain. And this is pain that has been lasting less than, about 3 months or so. Acute pain is very new and significant pain and is probably less than 2 weeks old, while subacute, same grouping here, but acute, subacute. Subacute is typically 2 weeks up to about 3 months. Now, the second type of pain is chronic pain. This is pain that is felt every day for 3 months or more. The National Pain Strategy can also define chronic pain as having pain at least every other day for 6 months or more. So there's a couple of different time stamps on that. Some say 3 months, some say 6 months. So I just tell people that pain turns chronic somewhere between 3 and 6 months. Now, the big difference between the two big types of pain here is in how they need to be treated in order to get rid of them. Acute pain or subacute pain is relatively straightforward, and it's a mixture of time, because your body heals naturally. So it's a mixture of time, and a healthcare practitioner can usually get it knocked out relatively quickly. Now, chronic pain, on the other hand, can be more of an issue. It can be a beast. It makes perfect sense that pain that has been affecting a patient for 15 years is much more difficult to treat than is pain that's only been hurting for a week or so. Now, did you realize that you really only have about 3 months before pain turns chronic and turns very difficult to treat? That's stressful, isn't it? Now, treatment for back pain has changed a little bit. There was a day when, for a bad back, your doctor would say, hey, take some pills and lie down in bed and let's let the pain pass. Now, we now know that that may have been just about the worst advice a healthcare practitioner could ever give for something like a bad back or a painful back. This is not to attack the medical profession. Healthcare progresses as we learn more and more over time through research. And then recommendations and treatment, it gets updated. For example, we now know that the best thing you can do for a bad back, a disc in particularly, like disc pain, disc herniations, is to typically get moving in the right directions. You need a healthcare practitioner to tell you how to move, but getting moving is one of the best things you can do. We've seen patients that have come in riding in a wheelchair because they hurt so bad that they couldn't walk. And for patients hurting on this level, some very brief bed rest may be appropriate, but in general, the best course of action is movement. Consider when a patient has an appendectomy, gets their gallbladder out, or gives birth. And while it may sound like high-level torture, you may have noticed that the staff and the nurses have those patients up and walking the halls just as soon as possible. Without continuing to dive deeper into very specific ways that chronic pain can be treated, I want to start calling attention to new recommendations from one of the biggest medical associations, the American College of Physicians. They now recommend spinal manipulative therapy as a first-line treatment for back pain. That was backed up very recently, back in October of 2020, by the American Family Physicians. And this is great news for patients and for chiropractors. Diving into the recommendations a little bit, you may be surprised to hear that they don't recommend going straight for shots or surgery or even medication. They don't even recommend MRIs and x-rays all the time either. Your first-line treatment for back pain is spinal manipulative therapy, exercise, massage, acupuncture, heat, low-level laser, yoga, tai chi, and cognitive behavioral therapy. Not to offend hippies, but not all of it, but a lot of that stuff may have been considered hippie stuff lately. But whoever's been doing all of this stuff for all of these years, they knew what they were talking about, okay? Spinal manipulative therapy, chiropractors do that. Acupuncture, chiropractors do that too. Massage and soft tissue work, all of this stuff. So we'll go through it a little bit. So spinal manipulative therapy, that's what chiropractors do. That is the cornerstone of almost every chiropractor's practice. The popping and the moving bones around and the adjustments, a little here and a little there, that's what we're known for, spinal manipulative therapy. Exercise rehabilitation. Now, what's the difference between physical therapy and exercise rehabilitation? You might ask that question, and well, the physical therapy profession owns the term physical therapy. So, there's the difference. While PTs may own the term and other professions are not allowed to use the term physical therapy, that does not mean that they own exercise or the ability to teach it and develop it. So chiropractors have been teaching exercises and leading their patients through exercises for years now. And I would argue that exercise rehab is even bigger now in chiropractic offices than it's ever been before, because more and more quality information continues to emerge centered around activity and movement-related activities. Massage, y'all. Okay, massage is easy to find. And it seems like, especially here in Amarillo, there's a massage establishment on every other corner. So while it's easy to find a massage therapist, it's not always easy to find one that can target your pain and the source of it. That's a little harder to find, right? The first thing you need to do is make sure that they're licensed. And you can do that by searching the state's licensing board for massage therapists. It's different for every state, so I can't just give you one link to go, but Google knows where it's at. Now here at Creekstone, since we do not depend on income from massages in Amarillo to pay our rent, we are able to keep prices very competitive and, shall we say, advantageous to your wallet or checkbook. Okay, moving on, acupuncture. We have an acupuncturist available here at Creekstone as well. And acupuncture has become quite the popular service. Once the VA system started sending veterans to Creekstone here for chiropractic and acupuncture, it kind of seems like a light switch got flipped on, because more and more people are starting to discover the benefits of acupuncture. And it's been exciting to watch it go from a little used service here in our office to one that has gained so much acceptance and is really being used more and more regularly. It's very satisfying. And not just by younger, hipper folks either. It's being used by older, more seasoned men and women that have been in the middle of life and death battle in the military, literally. Now, one of the other services recommended by the American College of Physicians and American Family Physicians is low-level laser. Isn't it great that this is now getting the recognition that it deserves? It's great for inflammation, sprains and strains, and for speeding up healing. Another service that we offer here that is really changing lives and preventing surgery is spinal decompression. Now, spinal decompression is the way to avoid surgery for disc injury, for stenosis, and or pain, numbness, and tingling into the arms and legs. It is absolutely phenomenal. We've seen the worst cases, and they were just about to go through surgery. We've seen those cases clear up and resolve completely just through non-surgical spinal decompression. And these are just, all of these services I just covered, they're just some of the ways that we've been able to get patients better, faster. Again, I have a fellowship in orthopedics, and that really, really does give us a leg up on getting our patients better, faster, which means it's more cost-effective to come here to Creekstone when you're hurting. And it's all based around evidence-based recommendations that have come down from the biggest entities in the medical profession, not even the chiropractic profession. So basically, there is no need to continue to suffer pain, and there is a time limit. If you sit there and let it nag for too long, 3 months or so, then it becomes very, very hard to deal with. So there's no need to continue suffering pain, regardless of how long it's been sticking around. If the patient is all in and willing to be a good teammate with us, we can usually do something about it. If you're watching this on YouTube, Comment, subscribe, and share this dude. We really appreciate it. It can make a difference. If you're watching on Facebook, like and share. I sure would appreciate it. If you're from the Amarillo, Texas area, or you're going to be traveling through and you need to be treated, just call us at 806-355-3000. Let's get you on the schedule. Until next week, I'm Dr. Jeff Williams. We'll see you then.